亲爱的朋友们，大家好，我叫帆，是Gen5生殖医疗中心的客户经理。自Gen5成立数年以来，我们接待了许许多多的中国客人，帮助他们成功的孕育了健康的宝宝。那随着越来越多的朋友通过口口相传，通过一个个真实的案例来联系到我们，今天我也非常荣幸的坐在这儿，和大家一起聊一聊Gen5生殖医疗中心为大家提供的各项服务、流程以及注意事项。Gen5生殖医疗中心坐落在美国南加州圣地亚哥，是一家集试管婴儿、精卵捐赠、第三方辅助生殖等一站式服务的生殖医疗中心。那我们今天也非常的有幸邀请到了Wood和我们中文团队的负责慧玲，跟大家一起聊一聊Gen5生殖医疗中心是何以成为世界一流的试管婴儿中心，以及为什么越来越多的中国客人选择我们。从我们收集到的中国客人提供的问题中，大家非常感兴趣的是Wood在亚裔大龄女性中的卓越的成绩和我们成功的经验。那我们今天也邀请到了Wood，让我们来听一听我们成功的秘诀到底在哪里。Okay, Wood, so we're so thrilled to have you here today with us. So Chinese patients do their homework before they come here. So they all want to know, what is your secret? Succeed with all the Asian women who have advanced maternal age and also have a complex reproductive history.
Chinese patients mean so much to me, so much. I've been to China several times, and over half of the staff here speaks Mandarin. We have put forth a tremendous effort to create the best possible environment for our Chinese patients. And Chinese patients are different, just as women from other parts of the world are different. And so you have to learn how to take care of them. You have to learn what works best for them. And we love patients of all ages. Obviously, when a patient's younger, it's easier to help them become pregnant. But our primary focus now is helping patients that are older reproductively, 42 and over. I meet these women and I know what amazing mothers are going to be. And it just breaks my heart that so many of them are told by their fertility specialist, no, you have to use an egg donor, or you have no chance. It's really sad because it's simply untrue. And so we do a wide variety of different things to enhance the chance that they'll become pregnant. We do ovarian rejuvenation, for example, which is a series of techniques that serve to make the ovaries younger, that serve to increase the quality of the eggs that are present within the ovaries. We use special protocols. We focused on finding the perfect protocol for Chinese women. And we do many other things too. We have a set of supplements that seems to work extremely well. And everyone here is obsessed. They're obsessed with doing everything right, with being as close to perfect as we can, so that the women that come to see us have the greatest possible chance of success.
Thank you. Thank you so much for your sharing. Let's move forward to the second question. 好的，那我们接下来的这个问题呢，也是大家关心的成功率。那大家都知道，我们所有的中国客人在来做周期之前，会完成超声基础卵泡的检查和激素6项的血检。那在这所有的检测中，有哪一些指标是和成功率息息相关的呢？我们来听一听Wood怎么说。
You know, to solve any problem, you need to understand it. You need to know what it is that's causing that problem. And then you can see what you need to do to solve it. So it's very important to me to really get to know the patient. And so, of course, we do an ultrasound, and we look at the ovaries. We look at the follicles within the ovaries. And you can tell a lot by doing that. Some follicles just simply don't look right. And then after you do the ultrasound, you need the blood work, because it's only when you put the ultrasound and the blood work together that you truly understand what's going on. And then you're able to provide them with a very real chance of success. And so I look at all aspects of a hormone profile. We look at more hormone indicators than anyone else in the world that I'm aware of. We do it at the beginning before we start so we can create the right protocol. And then during the protocol, we repeat this extensive testing throughout the cycle so that we see when we need to make changes to the protocol, when we need to respond to it. And that's the only way to get the best outcomes. And I think that's why we've done so very well.
Thank you. Thank you so much for the sharing. 下一个问题呢，实际上是一位最近联系到我们的43岁的中国客人。那客人是这样描述自己的情况的：我今年43岁了，卵巢功能很差，年龄也越来越大。我经过了非常多次的周期，但是都没有获得一颗健康的胚胎。那像我这样的情况，我还有希望吗？这个问题其实是一个很多我们中国客人都会问到的问题，也让我们把这个个案分享给 Dr. Wood， 看看医生是怎样说的。Okay, Dr. Wood. So the next question is actually come from one of the patients who just recently contacted us. She is 43 years old, and many fertility centers turned her down, saying, she has no hope. So she reached out to us, and she's wondering, do you have any special treatment could offer to her and to restore her confidence in potentially having a baby dream?
One thing's for sure. They're wrong. They're wrong. She does have a chance. And it really bothers me that fertility centers tell patients they don't have a chance when they do. But then I remember that 80% of the fertility centers in the world have never had a single live birth in a woman over the age of 42. So in a sense, they're telling them the truth. They're saying, if you come here, you don't have a chance. But that's not what they say. Instead, they say, you don't have a chance, which makes the patient feel like no matter where they go, no matter what they do, they're not going to have a chance. That is absolutely wrong. And that's why we're here. And that's what we work on day after day, is making sure that those women have a chance. The other thing that bothers me is women who only have one follicle or two follicles. And they'll tell them, you can't get pregnant. You don't have enough follicles. And that's so silly. Because when you look at the billions of babies that have been born in this world, virtually all of them came from a cycle in which the woman only had one follicle. And last year, I think it was 5 births from women that had one follicle, one egg, and they got one baby. So no one should feel like they don't have a chance. Everyone should have a right to explore the options and give themselves the best possible chance of success. That's what they deserve.
During the conversation our IVF coordinator had with the patient, we mentioned ovarian rejuvenation.
Yes.
So do you mind to give a little bit more details about, the special treatment for the patient? Yeah.
I think ovarian rejuvenation has really changed everything in the field. We've had so many women over the age of 42 become pregnant and have babies. And I give a lot of the credit for that to ovarian rejuvenation. Now, ovarian rejuvenation is a simple procedure, but you have to do it right. But what ovarian rejuvenation, a description of it is you have your blood drawn, then we isolate the platelets from your blood. The platelets are one of the cells that are present in the blood. And then there's several different generations of ovarian rejuvenation that we use, with each one right for different women. So when a woman comes in, is interested in ovarian rejuvenation, we go through the various generations and we show which one we think would be best for them. In some cases, there are 2 or 3 that are reasonable for them, and then they are able to decide. And generation 1 means that we take those activated platelets and we inject them into the ovaries. Whereas generation 2 means we take the platelets, we put them in the incubator, and then a couple of hours later, we take the growth factors that have been released from those platelets, and that's what we inject into the ovaries. And then generation 3 means that we do both generations 1 and 2 at the same time. And the reason we do that is that in combination, the treatment effect lasts twice as long. And so this is for women that we think have a relatively lower chance of success in any one cycle. And we want them to have multiple chances to succeed. But the thing I'm most excited about is generation 4. This is a cutting edge technique that seems to work extremely well. For example, that 47-year-old I just mentioned, she did ultimate, and that's what that's called. And what that involves doing is injecting other things, not just injecting the material that you receive from the activated platelets or the growth factors, but other things that enhance the ability of the ovaries to respond well to treatment and to give us a greater chance of getting that normal embryo. Only with a normal embryo can you get a normal child, a full-term child. So we look for that routinely. When we see a normal embryo, we cheer. We're happy because we know they have a very real chance of success once we find that.
Wow. I'm sure that our patient is going to be so happy to hear, whatever you just shared with them. 和卵巢复苏术相关的有2个大家非常感兴趣的问题。第一个问题是，在卵巢复苏术之后，大概多久我们可以开始周期？
The length of time a woman needs to wait before she starts IVF treatment is a really interesting question. We don't really know the answer. In general, we have patients wait 4 weeks, and then they begin, and the vast majority do very well. But in the past, we've had many Chinese patients who could only stay here for 18 days, 20 days. And so I tried a different strategy with them. Instead of 4 weeks, instead, it's 4 days. So we would do the ovarian rejuvenation, they would wait 4 days, and then they would begin their treatment cycle. And many of them did very, very well despite not being able to stay here in San Diego for roughly 6 weeks, which is what it takes if you wait 4 weeks. So I'm very pleased about that. I've thought about doing further research on it, and we may do that at some point. But we know that for many women, 4 days works, and for the vast majority of women, 4 weeks work.
好，谢谢 Dr. Wood 的解答。那我们的第2个问题和卵巢复苏术相关的是，在卵巢复苏术之后，对于客人的 IVF 周期的成功率有多大的帮助？
Again, that's a really, really good question. And I think what we found over time is that the worst situation is a woman that has no eggs. Those are extremely difficult cases that we're working on. And we want to do better even with those cases. But if you exclude that group, the more typical kind of patient that we see that still has follicles, they do very, very well. Not all of them respond, not all of them, but a significant majority do. And so I'm very pleased about the responses that we've had, and I continue to try to improve them. That's how I came up with Generation 4 of ovarian rejuvenation. I want to give even more women a chance to succeed.
刚刚我们聊了一下卵巢复苏，医生和我们解释了卵巢复苏术以及卵巢复苏术对我们亚裔大龄女性的作用，这个流程以及需要大概在这边待多长时间，完成卵巢复苏术之后才开始可以周期。那这些问题之后呢，我们再来问一问医生，关于如果说我们有一些大龄女性确实是不能用自己的卵子，或者说因为一些其他的原因不能自怀，看一看我们Gen5生殖医疗中心还有什么样的服务可以提供给大家。
You know, when we started Gen5, a lot of us got together and we tried to conceive of what the perfect fertility center would be like. What I think it's like is it offers everything, anything that a patient needs. And in order to do that, you have to offer the full range of services. Now, today we've talked about helping reproductively older women succeed. But unfortunately, sometimes it just doesn't work. And then there's some women that it's simply not safe for them, or they're just completely unable to carry a pregnancy. Some women are born without a uterus. They have no choice but to use a surrogate. And so we decided to create in-house surrogacy and egg donation. And just like everything else we do here at Gen5, we wanted it to be the very best. And we have just amazing teams that work on surrogacy and egg donation. And I'm so impressed with the work that they do and their ability to find fine women to be surrogates and egg donors. And we've had so much success, so many pregnancies doing that, that it makes me extremely happy And I'm really, really proud of the teams that are involved in this.
慧玲，所以很开心的今天邀请你也在这里和大家做一个分享。我们很多中国客人现在主动的联系到了我们，也是很想了解，那他们从过来这个前期的这个准备，一直到过来做的这些流程和安排，大概是一个什么样的一个节奏？能不能麻烦您和大家分享一下？
今天非常的有幸与 Dr. Wood 一起受约接受Fan 的采访。我会觉得说试管会有以下这4个比较大的一个流程。第一个就是我们的一个前期咨询。当然有的客人是做过试管这样的一个经历，有的客人是第一次接触试管，所以所有联系到我们 Gen5 的客人，我们都会给客人配备1对1的一个双语协调员。对，我们会给客人讲解所有的试管流程，包括医疗原理，回答客人所有的问题，帮助客人建立就是医疗档案，然后协助客人完成国内预体检的这个部分。最重要的就是会完成和医生的这样1对1的一个远程视频问诊。对，第二个呢，其实就是进入周期前的一个准备，尤其是还在国内的部分，医生会根据客人每个人的情况，包括 AMH 包括年龄卵泡的情况，给客人出示一个就是非常个性化的前期药的一个用药方案。我们不是一成不变的，我们一定是根据客人每个人的情况来制定个性化的方案的。同时还会给客人一些健康的建议，包括一些维他命的摄取包括一些良好生活习惯的建立希望我们能够在促排前就是精子卵子都达到最佳的一个状态。对，然后第3个其实最重要的就是赴美之后的一个促排的阶段了。从出诊到我们取卵结束，大概是会有2周的时间。在此期间，我们也会请客人每隔1-2天就回诊一次。我们会密切的监测这个荷尔蒙的一个变化，会密切的监测我们卵泡的生长的情况，
还是很频繁的这个。
对，尤其需要的话，就是医生也会及时的调整这个用药的方案。等到我们卵泡长到一个最佳的一个状态，就会破卵，然后进行这个取卵手术。对，最后一个步骤肯定就是实验室的部分了，也是非常非常的重要。对，我们会对新鲜健康的卵子进行这个包浆内单精子的注射，然后稍后还会有一个5到7天的一个这样的养囊。如果有需要做 PGS 筛查的客人，有可能需要再耐心的再等待大概10天、14天左右，因为PGS 会告诉我们，比方说我们胚胎的一个等级是否染色体是就是排序整齐的，以及胚胎的性别。那到时候我们客人就可以选择自己最心仪的胚胎进行移植准备了。
谢谢你的分享。那刚刚在你的这个分享中，我也听到了你提到的这个团队。那我很想就是了解一下，然后我也是相信，也是肯定是我们广大的这个中国客人非常想了解的，那就是他们飞过来以后是一个什么样的团队在接待他们，我们的团队的优势以及可以给大家带来的是什么？
在 Gen5 生殖医疗中心，我们的医疗团队大概是有25名专业的协调员，有英文，然后也有西语、中文这样双语的协调员。我们想要做到的就是在客人进行对于他们来说非常重要而且也非常紧张的这样的一个周期里边，他们可以有自己1对1的这样的一个协调员，可以很及时、很专业的把医疗信息提供给他们。如果有任何问题，我们可以及时的得到一个解答。我觉得最让我感到骄傲的一个地方是，每一位协调员都有着非常强的一个医疗背景，这是第一个。然后同时他们又有着非常强的责任心、同理心，他们能够深刻的了解，这并不是一份朝9晚5的工作，他们真的是把自己的一个责任感，就是客人交给我们的一个使命担在了肩上，然后真正的去希望能够帮助客人成功。我想举一个小例子，就是我们团队里边有一个非常好的默契和习惯，就是客人第一次来打针，因为有可能国内会 有护士帮助打，因为在这边都是自己要完成打针。对，协调员都会在客人打第一针的时候会定好表，他自己定好表，会去提醒客人说把药剂调节好，我们要打针了，让客人缓解这个打第一针的这个非常紧张的情绪。对，然后一样的就是等我们周期进展很顺利，然后等到我们到最后破卵针的时候，这也是一个非常重要的一个环节，需要准时准点正确的注射，然后同时也会就是基本上都会陪伴我们客人完成这个最重要的最后一针。所以我就觉得说，和这么专业，然后就是有责任感的一个团队工作，绝对是让我们试管事半功倍。我们真的就想做一个非常有凝聚力，然后非常坚韧的一个桥梁一样，搭建好从客人到我们医生、病患，然后到我们医疗这么一个协调的工作。所以对，这是我想要分享的。
就听你这样分享，我都会觉得我们所有的这个中国客人都可以非常放心的把自己交托在我们这个团队的身边。
对，这也是我们想要就是传达的一种精神吧，是我们Gen5的一种精神。
是的，非常非常感谢你的分享。我们接下来的一个问题，其实也是大家很关心的，就是我们的这个生殖服务。那刚刚我在这边有介绍，我们Gen5生殖医疗中心是一家集试管婴儿、精卵捐赠以及第三方辅助生殖等一站式服务的生殖医疗中心。那今天能不能也邀请你和大家讲一讲，我们提供哪一些第三方的辅助生殖服务？
就如 Dr. Wood 刚才所说，我们Gen5生殖医疗中心想要提供给大家的不光是精湛的医疗技术，同时也有对于一些因为先天或者是后天原因不能够完成自精卵自怀的客人，提供这样一些第三方生殖辅助。我们想要打造的是一个从捐卵代孕到生殖一站式的一个服务，对于有需要的人群可以提供最专业的一个生殖辅助。就如我们所有的捐卵女生，我们所有的代孕妈妈，全部都是由我们自己完成招募的，这就让我们就是可以更加保质保量的完成招募的工作。同时我们也有一个非常庞大的一个卵子库，我们希望给客人提供的是一个非常丰富的资源。捐卵这边大概从您选到女生到周期结束，大概是需要3-4个月的时间。对，因为女生需要做心理筛查，然后需要做体检，需要做法律流程，然后到最后我们才能够就是走到促排的阶段。同样的，代孕也是需要大概4个月，甚至稍稍更久的时间。它的流程更加的冗繁，我们需要调取孕妈妈以前的生产记录进行审核，我们需要做心理筛查，我们需要体检，我们需要做法律，然后才有一个就是走到移植的阶段。对，就虽然这个过程听起来是比较久的，但是我们想要保证的就是各个环节的一个准确性，一个专业性，这也是我们想要就是为客人提供的最佳的一个解决方案。
好，非常感谢你的分享。我们非常开心今天邀请 Dr. Wood 和慧玲在这儿和大家做的分享，相信大家一定是受益匪浅。那如果说大家有任何的问题，我们也欢迎直接联系到我们，我们将在视频后和大家一一解答。